Welcome to your second lecture, The Need for Telehealth, Making a Case for Telehealthcare Services. When we think about the healthcare system at large, there's a tremendous gap between available services and clients who need services. This gap becomes even more pronounced when we look at mental health care. 1 in 5 adults has a mental health condition. That's over 40 million Americans, more than the populations of the state of New York and Florida combined. Youth mental health is particularly worsening. Rates of youth depression in 2011 were roughly 8.5%. In 2014, however, that number raised another 3%. In addition to the increasing number of Americans who are faced with a mental health condition, more and more Americans are receiving access to services due to increased insurance. So, with access to treatment, 19% remain uninsured in states that do not expand Medicaid, whereas 13% remained uninsured in states that did expand Medicaid. Looking at this number, it seems most Americans lack access to care. In fact, 56% of American adults with a mental illness did not receive treatment. Even in Vermont, the state with the best access to mental health care treatment, 43% of adults with a mental illness did not receive care. There's a serious mental health workforce shortage. In states with the lowest workforce, there's only 1 mental health professional per 1,000 individuals. This includes licensed clinical social workers, psychiatrists, psychologists, and other counseling and psychiatric nurses combined. If you look at states that have the least access to care, it's interesting how this correlates with higher rates of incarceration. For example, Arkansas, Mississippi, and Alabama had the least access to care and the highest rates of imprisonment. There are over 57,000 people with mental health conditions in prison and jails in those states alone. That's enough to fill Madison Square Garden 3 times. Telehealthcare is a creative approach to meet this demand. Telehealthcare has shown to be a viable option for clients and patients living in remote and rural areas, for those who are homebound or unable to get to hospitals or other healthcare provider facilities, and for those who have logistical obstacles such as families, jobs, or lack of transportation. However, when we look at who covers telehealth care, unfortunately, Medicaid and private payer coverage reimbursement policies have not caught up to the access or ability for clients to access telehealth care. According to this map, we can see how many states allow and approve telehealth care services through Medicaid and private payer insurances, and through no insurance at all. As you can see, Rhode Island is the only state where there's no coverage for any type of telehealth care services. The majority of states allow Medicaid and private payers to cover these types of services. While it's not perfect, slowly and surely, insurance companies are beginning to provide more and more telehealth services, as it's seen as a cost-effective way to divvying out healthcare. One of the reasons Medicaid and private payer health insurance companies are beginning to cover telehealth care services at higher and higher rates is because telehealth care has shown to not only improve patient outcomes, but to also improve organizational capacity to treat patients and clients. In a nutshell, telehealth care brings care to the client. In remote and rural communities, clients can more easily obtain clinical services. If clients are more easily to obtain clinical services using telehealth care, this means that hospitals can now focus on providing only emergency and intensive care services. Clients and patients who used to come to the emergency room or the emergency department as a way of meeting their needs instead of seeing clinicians during appointments are now allowed to access telehealth care and get their needs met. This reduces delays and waiting times in the healthcare system. The reduction of delays and waiting times has shown to increase patient outcomes. Timely telehealth service delivery improves patient outcomes in a number of ways. First, it leads to reduced complication and reduced rates of mortality. When patients are more able to see their physicians in a timely manner, they're more likely to catch complications or issues that could potentially turn into something more life-threatening at an earlier rate. In addition to improved health outcomes, the improved patient satisfaction has also been shown to be correlated with timely telehealth service delivery. Patients who don't have to wait as long to see physicians are more satisfied with the overall healthcare process. Additionally, telehealth service delivery has led to more client self-determination and better participation in the healthcare system. Clients are more likely to receive treatment when they understand that there's less stigma associated with doing so. This creates an internal as well as external motivation for seeking out services when perhaps a client may have been resistant to do so in other ways. Another benefit of telehealthcare services that research has recently identified includes the improvement of organizational productivity. For example, healthcare providers who previously did home visits now have a reduced travel time. This means that they're able to see more patients in a shorter amount of time, increasing their efficiency. Additionally, the reduction in traveling to and from different locations, potentially over very far distances, reduces the amount of carbon emissions from gas that are released into the environment. In addition to better staff efficiency, telehealthcare services are highly associated with reduced lengths of stay in hospitals and other inpatient facilities. Currently, one of the biggest cost expenditures of hospitals and other in- and outpatient facilities is the amount of time clients stay without receiving services. Telehealthcare allows clients to access preliminary services earlier on in the disorder or illness process, thus reducing the need for more intensive services. When patients are allowed to leave the hospital at earlier times, or who even are prevented from entering the hospital because they received services earlier, this allows hospitals to spend more time and energy treating patients who are in emergency and urgent situations. This leads to overall better organizational capacity, staff efficiency, and function. Not only is telehealthcare associated with improved patient outcomes and improved organizational capacity, but it helps reach populations that may otherwise not be able to access healthcare. Let's look at the case of Veterans Administration and their continued use of telehealth services with service members. Currently, there are over 2 million service members deployed in combat zones. As many as 50% of these service members screen positive for a medical or mental health issue, and roughly 200,000 have a traumatic brain injury. Suicide rates across the Department of Defense have skyrocketed. In response, the DoD established a web-based clinical mental health service program in order to deliver care to deployed service members or those living in rural areas in 2009. Since then, 10,000 individuals have accessed telehealth services and have received mental health care counseling as a result of this initiative. Given this and other similar stories, it proves imperative that we look at telehealth as a viable option for treating populations who may not otherwise get services.